Hello, scholars. My name is Dr. Kerris Dillon, and the goal of this channel is to make academic subjects easier to understand. If you haven't already done so, please click that subscribe button and like button so I can continue to bring you the videos you want. In the last video, we covered obsessive compulsive disorder. In this video, we're going to look at body dysmorphic disorder, so let's begin. In order to be diagnosed with body dysmorphic disorder, an individual has to have the following symptoms. A, the individual is focused on what they perceive as flaws concerning their appearance, which may not exist at all or may barely be noticeable to others. B, the individual has created and acted out regular behaviors or mental repetitions because of their concerns with how they look. These may include but are not limited to skin picking, constant grooming, trying to gain reassurance about their appearance, a constant comparison of one's own appearance in relation to others, or checking the mirror multiple times. C, these acts or mental repetitions cause distress to the person and affect their social life, their job, their schooling, or other situations. D, the concerns about one's own body do not only focus on BMI or body fat, which may end up being an eating disorder instead of body dysmorphic disorder. Now, the clinician will want to make sure and to specify if it's with muscle dysphoria. And this is when an individual believes themselves and their muscles and their body to be too small. And that's where the preoccupation stays. The other one they want to specify if with good or fair insight means the person comprehends that the way they feel about their body is probably not true. So they really do understand that I feel like I'm huge, or I feel like I'm like this mole I have is sticking out and everybody's seeing it and they're all looking at it like it's ugly. You know that's probably not true, but you still kind of feel that way. Then, of course, you have with poor insight, the individual thinks their body issues are probably true. And then with absent or delusional beliefs, they believe that their body has problems and they believe that their delusions are true. So maybe you have a mole on your face and you believe that everybody is staring at it and it makes you so ugly and you're trying to do anything possible to cover it up. And you're very worried that everybody's going to see it. And it makes you feel awful. That can definitely be with absent or delusional beliefs. Others will look at it and barely probably notice that it's there. With body dysmorphic disorder, the individual feels that one or more body parts are significantly flawed, and this is impacts their physical appearance. The individual can believe that they are ugly, deformed, unattractive, or look abnormal. When other individuals look at this person, though, they don't seem to see the flaws that that person is seeing, or they think they're making more out of it than what the person believes is true. When a person has body dysmorphic disorder, they may believe that something is wrong with their skin. They may think they have too much acne, have too many wrinkles or lines, have scars, or that they don't like the color of their skin. They may focus on their hair, including how much body hair they have. They also may think their hair is thinning to the point that maybe they're going bald. They also may think about everybody sees their body hair, whereas the person can hardly see it at all. The nose is another feature that is often focused upon. Many individuals might think that their nose is too long or too short or is bent or maybe looks like a pig nose. The lips can also be criticized because they may be too thin to the person or too big. Basically, any body part can be focused upon. These thoughts about the person's body, that person is experiencing very unwanted thoughts, and it consumes a lot of their thinking and a lot of their day. And they get distressed from this. The individual that has them will struggle with trying to get rid of the thoughts or rid of the preoccupations. Along with having these intrusive thoughts, people with body dysmorphic disorder will have behaviors or thoughts that will play out in their head that reduce their anxieties about their body. These can be acts that are pretty time consuming, but the person feels compelled to perform them. So these can include, but are not limited to, covering a perceived defect with clothing, scarves, or hats. They may excessively work out or try to lift weights for tons of hours, even to the point that they're causing their body damage. They may groom themselves for hours, pulling out extra hairs or trying to put makeup on perfectly. They may tan their skin to different colors, trying to make that perfect skin color look. They may change their clothes tons of times, looking for the right outfit to hide what they feel is a body or bodily defect. Individuals may pick their skin, trying to make something on their face, neck, or shoulders look better. This is scary because that can lead to infection. Anytime you have an open wound, that can lead to bacteria and infection. Muscle dysmorphia is a disorder that seems to impact males much more than females. This is when an individual believes that their body is too small. Generally, these persons have an average-shaped body, or they can even be bigger and very muscular and still believe that they're very small. Individuals with this disorder may also preoccupy themselves with their body hair or the overall texture with their skin. There is a point where they will begin working out usually and end up harming their own body because they're doing the workouts too often. If the person is using steroids, this can cause even bigger issues. Usually persons with this disorder tend not to be aware of the actual truth of their body and how big it actually is. Those with more forms of severe body dysmorphia are at a much higher risk for suicide than those with an insight into their own problems and issues. Most of the problem for those with body dysmorphic disorder is the belief that others are mocking or they're making fun of their body. These individuals also tend to suffer from anxiety, social anxiety, depression, avoidance of certain social situations, neuroticism, a low self-esteem, and attempts maybe to be as perfect as they can. Usually they're very ashamed of how they look. They don't tend to want to tell others this, though. Many will try and consult with plastic surgeons and usually will end up getting some type of cosmetic surgery. Now, if they don't like the outcome, and many of them do not, they may become violent with their cosmetic surgeon or very, very angry and scream at them. In rare cases, individuals might try to do surgery on themselves, and this, of course, is not good under any circumstances. It has been shown via various studies that persons with body dysmorphic disorder have some visual processing problems and don't tend to look at the whole picture of themselves, but focus on minute details. They also tend to interpret facial expressions more negatively than others do. In the United States, 2.4% of people are diagnosed with body dysmorphic disorder each year. In other countries, it is lower. That percentage is lower. These issues tend to come about when individuals turn 12 to 13 years old. The majority of cases will come about before the age of 18. This also links them to a higher risk of potential suicide as well. Usually these symptoms come about slowly, but there are a few cases where the symptoms will come on rapidly for someone. There have actually been cases with the elderly that someone will develop this as an elderly individual, but we have very, very little research on this age group, so we don't have a ton of information about that. For most individuals that develop this disorder before the age of 18, there is a high number that will also be diagnosed with major depressive disorder. Social anxiety disorder as well as substance use disorder can also accompany this disorder. Okay, that is the end of the video. I hope that you liked it, and I hope it is informative and helps you out with your classes or just to increase your basic understanding of mental illnesses. Thank you so much for coming to this channel and listening. I really appreciate it, and I hope you have an amazing day, and I will talk with you soon.